Good afternoon, everybody. Thank you for being here today for such an exciting event. To get started, we would like to introduce Tammy Bending, our Vice President of Critical Access Hospitals, Berlin and Wild Rose.
Thank you, Cassandra. I'm going to take this off. Easier to speak without it. Well, good afternoon, everyone. Thank you for joining us this afternoon. I know many of you are sitting here thinking, was this day ever going to come? And it's here. I can't believe it. I still feel like it's a little bit surreal. But I do want to, before we get started, welcome our system board member, John Davis, our local board members, Craig Batley and John Blazel, our construction friends, HGA, and architects, our construction friends, Bolt, and our architects, HGA. Sorry, guys, I'll get it straight. And then our ThedaCare family of foundations representatives, the Berlin Journal, and all of our ThedaCare team members. So, to ensure access for an increasing demand for emergency care, we're proud to break ground today on the ThedaCare Medical Center-Berlin Emergency Room Department. ThedaCare continues to prepare and respond to the needs of the community and keeping our patients and families first, now and always. We want to celebrate this milestone in a safe way, of course, which is why we've asked you to socially distance, wear your masks, and use hand sanitizer. So thank you for doing that today. So the groundbreaking and the work that's been done represents the commitment to our community because investing in a new emergency department will ensure the people of Berlin have access to the needed care and services that they deserve. Our goal for this project is to create a modern facility that will provide the best experience for patients, families, and our team members. So to give you a little background on this, here's how we serve the people in the Berlin area. We have about 70,000 ambulatory visits a year, 8,000 ED visits, 4,000 surgical procedures, 3,000 oncology visits, 2,000 admissions, and the new ED will enhance the care that people of Berlin have come to expect from us and deserve. So I'll tell you a little bit more about the project today. The consumer-focused design of this new ED is centered on the well-being and ease of patients and families in a comfortable, soothing environment. The design was a true partnership with our physicians, our clinicians, and our staff to enhance the patient and provider care experience. And I do want to call out Pam Mork, Kelly Schmoody, Melissa Paul-Cavage, and Marie Knuth. Thank you very much. They were deeply involved. Marie and Melissa are two of our nurses in the emergency department who put a lot of time and energy. So thank you, ladies, for this dream come true. So we'll be increasing the number of treatment rooms from 7 to 9. We're going to increase the size of the rooms and much more. This will allow patients to have their families with them, of course, once we get through COVID. Have their families with them, and then there'll still be plenty of space for our healthcare workers to provide treatment, right, ladies? So we will have, as looking at our community and who we serve, we also looked at the fact that we needed a decontamination room inside the building, not just a tent we put up in the parking lot, similar to the one you're sitting under. So we will have that as part of our agricultural and farming community. We do have chances that, it's real, that we could have a chemical spill or something of that nature with the businesses we have. Now we'll be able to take care of those patients should we need that with ease. The nearly 9,000 square foot emergency department at ThedaCare Medical Center-Berlin is expected to open in the spring of 2021. And we're looking about total cost estimated between $7.5 and $9.5 million. We're kind of shooting in the middle range there, so. Our current emergency department, though, will be operational throughout the project, so patients will still be able to access us, maybe in a little bit different way, but we'll certainly have directions and signage for them. It'll be a little different for our team, but they're very excited to have their new ED, so at this point they're willing to do anything, right? So by updating our ED, we want patients to feel comfortable, knowing they don't have to go far to get the kind of care that they need and they deserve. Our goal is to empower each person to live their best life. So now I'd like to talk about the Berlin community. This has been a long time coming for the Berlin community. They're very excited about this. Unfortunately, not being able to have more people here today, but we know why. We need to be safe. So, enhancements to a better patient experience are being funded through the generous donors who support the ThedaCare Foundation Berlin. This is part of our larger ThedaCare family of foundations. The foundation itself is going to contribute at least $500,000 commitment to the ED project, which will include a number of fundraising efforts in the community. As an example of that support and community support, that can be found in a former healthcare employee. Tammy J. Shire and her family are here today. Tammy, where did you go? There you are. I'm looking back at your daughter. Thank you for being here today. Tammy said she knows how important it is to have access to emergency care and updated technology and equipment in rural areas that can be trusted to deliver the quality of care patients and families deserve. Tammy has graciously committed a pledge of $250,000 for the project, and now she has a request for the community. She wants others to come together to support the project and match her pledge because by supporting ThedaCare's efforts of a renovated ED area, it'll ultimately make our community healthier and stronger. Tammy, we are forever grateful for your support and appreciate the leadership you've taken in the community. I know you'd like to say a few words, so I welcome you to come up now to say a few words.
I wasn't really prepared for this, but it's going to be repetition of what you've already said. I'm just going to enhance it just a little bit. A lot of people wonder why I'm doing this, and I am a resident of Washera County right now and a former resident of Green Lake County. I've been on different sides of our local healthcare. First being an 18-year-old health information employee here at BMH and CHN, on the outside of treating patients, assuring quality of care, monitoring quality of documentation, and assuring accurate information is submitted to payers for the reimbursement that we deserve. Second, I have seen and experienced the kind of care and equipment needed in the case of our son. Fighting for his life after an anaphylactic event and the need of access to a secondary facility, and my own need for treatment with my bout of breast cancer. Thirdly, I have had and still have many friends and family that are in the healthcare field, including our daughter, who is finishing her RN degree. They all want to stay in the area and practice their profession faithfully. And finally, I still want to contribute to the necessity of quality health care in our rural area. I apologize, but I'm passionate about this donation. There has been and still are individuals in my life that have allowed me this opportunity. It is with great honor that I present these blessings to the ThedaCare family of foundations for the Berlin Emergency Department. And I challenge the community to match the foundation's donations and my donation in order to make this a grand, local, rural emergency room. Thank you.
Tammy, thank you so much. And again, we will forever be grateful to you. Thank you.
You're welcome.
Okay, at ThedaCare, we're committed to keeping care local while fulfilling our mission of improving the health of the communities we serve. This renovation helps us fulfill that mission, providing care local at the Berlin area community. So, without further ado, I'd like to introduce you to John Blazel, our board chair, Berlin board chair. John?
Thank you, Tammy. It's an honor to be here today representing the board at ThedaCare Medical Center-Berlin. I've lived and worked in Berlin for over 20 years. I've raised my family, my 2 daughters here with my wife, and I've seen and experienced firsthand why it's important to offer quality health care to rural areas, and I'm proud of this commitment that we're making today. Healthcare has a long history in Berlin, starting with the Yates Memorial Hospital, which opened in 1912. Hospitals experienced many changes over the decades, with one of the more recent being the hospital's affiliation with ThedaCare in 2014. It's critical that we continue to provide health care here in Berlin, and we are doing so. Today, we can get cancer care treatment in Berlin, we can see a cardiologist in Berlin, and access specialists without having to drive to the valley. And when we need it most, emergency care will continue to be right here in Berlin. As a result, we're proud to support the current renovations and future projects in Berlin. We're doing this work because we understand how important it is to have quality care like this for our family, friends, and neighbors. The new emergency department is designed to serve both walk-in patients and patients who arrive by ambulance. There's going to be separate entrances for walk-ins and ambulance arrivals. The services, such as diagnostics, are going to be adjacent to the emergency department, so it'll be convenient for patients to get the services they need without having to be transported through the hospital. The emergency department patient rooms are going to be larger to allow families to be with patients, as Tammy had said, and to still allow our medical staff to provide the care that's needed. During the design process, we considered our healthcare team member needs and wants, and as a result, the healthcare team's workstation is going to be in the center of the emergency department with treatment rooms around the perimeter. This is going to allow the doctors and nurses to be able to see into the patient rooms. This was deemed to be a critical thing for providing quality care and patient safety. The emergency department at ThedaCare Medical Center-Berlin will feature the newest technology and equipment. The building, the addition is designed to reduce costs, to improve capacity, to provide sustained operational efficiency, and to create an exceptional patient experience. We're very excited to see this happening, and we're looking forward to the completed project. Now I'd like to introduce Lynn Detterman, the Senior Vice President of ThedaCare South Region.
Thank you, John. So my name is Lynn Detterman. I know I haven't had the opportunity to meet a lot of you. I am very pregnant, right? ThedaCare recently divided into 3 regions. So if you're wondering why I'm here today as the South Region leader. So we now have a North Region, a Central Region, and a South Region. And I have the pleasure of working with Tammy and her fantastic leadership team every day. And so I'm excited to be here and part of this project. So thank you to our board members, construction and architect teams, the ThedaCare family of foundations, and our team members. Today, we'd also like to take the time to thank our construction and architect partners, Bolt and HGA. With their help, we have designed this space around patients, families, and team members. So please stand to be recognized. I'd like to thank each and every one of you here today for making the vision a reality to provide all patients the level of expertise that they deserve. The need for emergency services in rural markets such as this are significant. A study in the Journal of American Medical Association demonstrates that rural EDs have experienced more than a 50% increase in patient visits over the last 10 years, despite a 5% decline in the overall U.S. rural population. We know that these needs are different for people living in rural areas. Our teams work to understand a person's unique medical background, lifestyle, and personal goals, getting patients back to living their best life sooner. According to the Wisconsin Health Association, the Federal Health Resources and Services Administration has ranked Wisconsin's critical access hospitals third best in the nation for healthcare quality reporting and improvement measures. ThedaCare Medical Center-Berlin is an accredited critical access hospital by the Joint Commission, earning a gold seal of approval by demonstrating continuous compliance with the performance standards. Today, more than ever, rural communities must address specific issues not all Americans face. Some issues include meeting the needs of an aging population, treating and maintaining chronic conditions, and providing access for a larger percentage of uninsured and underinsured people. This is about putting our patients and families first. We want to provide the best care for our rural communities. I feel fortunate to witness the groundbreaking for this emergency department. It comes at an important time in healthcare, not just for ThedaCare, but for the world. During this pandemic, ThedaCare continues to prepare and respond to the needs of the community, keeping our patients and families safe and healthy now and always. Our commitment to providing emergency care in rural areas stands strong, while we are also dedicated to COVID-19 prevention, treatment of patients, and protection of care teams. It also comes during an exciting transformational journey to population health for ThedaCare, which includes all of our locations, including the most important, the rural markets. Population health, a revolutionary big idea about how improved community health can be achieved while lowering the total cost of care and immeasurably impacting the quality of care delivered. We are transforming to become a national leader in population health, working every day to provide care that is high quality, safe, that puts patients and families first. ThedaCare wants to lead the way for helping our families, friends, and neighbors take control of their health care experience and being there when they need acute or emergency care. Together, we will make it easy for all of us to live our best lives, improving the health of the communities we serve. So with that, I'd like to invite you all to join us to, before that, sorry, I'm getting ahead of myself. I forgot about my boss. So I'd like to invite Dr. Andrabi up just to say a few words.
Thank you all. I don't have a speech, but first and foremost, Tammy, I want to thank you and your family for your graciousness. You serve ThedaCare and the Berlin community while working in ThedaCare, and you're serving us not only today, but in the future as well. So my sincere thanks to you and your family for this tremendous honor. Thank you. The words that come to mind are gratitude. We are who we are at ThedaCare by virtue of us together. And it's not just about the Valley, and it's not just about a trauma center, and it's not just about this or that. When we all come together, we are better together. And the needs and wants and requirements of a rural community, as everybody has already said, are different than they are in a different community. And so knowing them, understanding them, and meeting them where they are is extremely important. So I'll just say that I'm so proud of the team members here in Berlin and the work that each and every one of you do every day to make a difference in the lives of people that we touch. Even during COVID, we do touch people, and we do it in the right, safe manner, and we improve lives every day. The other thing I would say is I reflect back to July of 2018, And John is here, so John remembers this. We actually brought our entire board to Berlin to have a board meeting here. And that was actually done by design. He didn't know that back then. And the reason was because I wanted the board to come and visit one of our rural communities, and they've done so every year since then. But I also wanted them to walk through the emergency room. That was done by design as well. And it became really clear really quickly, even to John, who's not a clinician, that there's something not right about this. Right? And so when the time came to go in front of our board and say, we need a new emergency room in Berlin, it took less than 30 seconds for the board to say, yep, we were there, we remember, and you should go do this. So thanks to the board here, thanks to the physician leadership, the nursing leadership, and all the team members for everything that you're doing. And I look forward to this exciting new journey. And hopefully we continue to do great things here in this community and many of our other communities in the rural areas in Wisconsin, and truly improve the health of the people that we serve. So thank you very much for being here. And Lynn, can I?
Yes.
Let's walk over and do some groundbreaking. Thank you.
All right. 3, 2, 1. 2, 1.
My wife, yep, it's gotta be